Hello. In this video series, I aim to provide you with an updated version of the key concepts that you need to know so that you can easily master and be successful in a medical or doctor job interview. Hi there, I'm Dr. Anthony Llewellyn, the career doctor, and I'm an experienced medical HR expert and interview coach. Now, I've set myself the challenge of going over the 7 most frequent interview question types that come up in most medical job interviews, be that a traditional employer panel interview or a college selection interview using a multiple mini interview technique. And I aim to do this in a total of less than an hour so that you have the essential information that you need. Now, this first video is an introduction to the topic. In it, we are going to answer the question: what are the common doctor job interview questions and why are they asked? But if you just want to get into the questions right now, feel free to click the link on this video and skip ahead to the About You question. Okay, for those of you who are still with me, this is what we're going to cover in this video lesson. 1, what are the most common questions in a medical job interview? 2, what order they are normally asked in? 3, why they get asked? And 4, how you can start preparing for these questions now. So I'm going to take points 1, 2, and 3 together, and then at the end, I will come back to point 4. Now, when I talk about a typical order of questions, I'm talking about a traditional panel interview where you, the job applicant, are interviewed by a group of people together. Now, obviously for an MMI, that's a multiple mini interview process, in that interview, the order is going to be a little bit more random. So in a traditional panel interview, the general order or run of things is going to be 1, an initial opening question that is pretty general and asks why you have applied for the job or what skills you bring to the job, or some other version of either or both of these questions. Now, this is done partly to enable the panel to get up to speed with who you are, but also to give you an initial opportunity to demonstrate how you can meet the selection criteria for the job. Now, this initial question may or may not be followed up by a question about your strengths and weaknesses. Again, the point here is to explore what value you bring to the role, as well as whether you have any key deficits, and also if you have reflected on what challenges you may face in the job. Now, thirdly, after this initial question, it is quite common to be given at least one clinical scenario and be asked how you would deal with this situation. It is, of course, a medical job interview, so it would seem unusual to not have at least one clinical question, but there are deeper reasons for asking a clinical scenario. The panel may want to understand your process for dealing with a challenge, and often there are other aspects to the scenario other than the clinical, such as resource problems or ethical problems, that sort of thing. Now, fourth, next we generally have 1 or 2 questions that explore some of the other non-clinical selection criteria, such as communication, teamwork, and quality improvement. These are generally asked as what is called a past behaviour question. So the idea here is to ask for past examples in your work that demonstrate that you can meet the challenges of the job you are applying for, i.e. past behaviour predicts future behaviour. As a general rule, there is stronger evidence in recruitment for asking for examples of key behaviours such as demonstrating teamwork than asking a situational or theoretical question. Or to put it another way, it's much easier for candidates to talk about what they would do rather than to talk about what they actually did. Now 5, towards the end of the interview, you may be asked another scenario type question. This will tend to be around exploring key professional challenges that may come up in the role. For example, helping a colleague who is struggling or pointing out to a senior colleague that they are about to make a mistake. The main point of these questions is to see whether you would have the confidence to deal with a difficult and challenging scenario and to be able to put patient safety first. Again, towards the end of the interview, you might be asked a question about your understanding of the role or your opinion on a topical or controversial area relevant to the job that you have applied for. The main idea of these questions is to see if you have the capacity to reflect and identify key issues and bring a broad perspective to the role. Now, finally, at the very end of the job interview, there will come a moment where you are informed that the interview is now complete. If you're doing an MMI interview, then that will be it. But if you're in a panel interview, it is traditional in Australia to be asked a final informal question along the lines of, do you have any questions for the panel? In most cases, it's best to answer with a no thanks, but we'll cover a few other options for you in our final lesson of the series. So that's the what order, and the why of the doctor job interview. But the final question is, how can you prepare for these questions? Well, now that you know what these questions are going to be, you can start preparing model answers for them. I recommend that you do this by also having alongside with you the selection criteria for the job that you've applied for. The interview questions should always be based on the selection criteria. So for example, you can start planning how you would provide an example that demonstrates how you meet each of the selection criteria in case you're asked one of these as a past behaviour question. Now, if at any point you feel that you've gotten value out of this video series and want a deeper dive into mastering the doctor job interview process, then I highly recommend my Doctor Job Interview Skills course, where I do a much deeper dive into each of these question types, along with the other questions and a lot more concepts to help you truly excel in your next medical job interview. For example, in the course, I go over a number of other steps to help you brainstorm and prepare answers for interview questions. If you click on the link in the description or at the end of the video, you can purchase this course for a special discount just for watching the whole way through. I'll see you in the next lesson.